Hello, everyone, and thank you for joining us today in our telehealth program proposal presentation. We hope to show you all the steps necessary to successfully implement a telerehabilitation program in your healthcare physical therapy setting. Our goals and objectives of this implementation are for a program to be consistent and trustworthy, easy to use, increase patient engagement, and of course, reduce the cost on both the provider and the patient. We will measure this using several metrics: the average time spent per patient visit, the platform uptime, which is ideally 100%, the number of telerehabilitation versus in-person consultations, and the number of missed appointments, both telerehab versus in-person, of course, the patient retention rate, and any additional metrics that are needed as we move on with the implementation. We suggest a project plan timeline of 21 weeks, starting off with initiation, planning, in-depth risk analysis, followed by stakeholder approval and implementation, and of course, ending off with project milestones and the closing of the project. Our value proposition to patients is that it will save them time and money by reducing their traveling time and visit costs. It'll help bring their physical therapist home with them for more specific personalized advice, specifically about their environment and any hazards that they may have. And it'll help them gain instant access to their physical therapist when they need them the most. By implementing telehealth, it'll increase the patient reach with the aid of technology. Although, as you can see here, there's only a $45 visible increase in revenue per visit, with an average of 15 patient visits a day and 261 workdays a year, this will generate a large revenue increase of $176,000 a year. It's been calculated that the average no-show rate is 5 to 7%. If one no-show occurs on a daily basis with an average copay of $30 and reimbursement of $100, this will quickly amount to a cost of $32,000 a year. Telehealth has been shown to decrease that rate by 5% and increase retention rates by 81%. Every 11 seconds, a senior citizen goes to the ER after a fall. This ends up costing the healthcare system $50 billion in total medical costs. In 2015, $29 billion of that was paid by Medicare. If PT telerehabilitation is expanded on a broader scale, more seniors will be able to access these services, which will reduce the possibility of a fall and avoid the resulting medical expenses that come along. We have compared 3 technology solutions that we chose to be our top choices based on technology, price, and features. Our top choice was InTouch Health due to their great customer service and, of course, their reduction on the provider's workflow. They implement with your EHR, they're interoperable, and they're willing to work with you if you want any custom solutions after the implementation. They also help you partner with your local employers to provide on-site, near-site, or at-home care, which will help extend the community of care to local employers and their employees, which are going to be your patients. The estimated cost of this program is about $180,000, which would be returned very quickly in this investment based off of our revenue model explanations. We cover in this estimated cost the devices needed, an extra room for telehealth, and of course the employee training. One of the most difficult impediments to practicing telemedicine is the inconsistency and variability of requirements for physicians to obtain a medical license in different states. It's been shown, however, that the Interstate Medical Licensure Compact, IMLC, makes this application process easier for experienced physicians with good practice histories to apply for interstate licenses. As you can see, there's already 25 states that are in this compact. And of course, they're still working on other states, and it has been introduced in many others. There are many legalities, of course. We have the infamous HIPAA, high-tech laws, and there's also the anti-kickback statute. These are all 3 laws that are very important and can be costly if they are violated. To avoid legal complications, we provide a governing policy that must be put in place and followed carefully. This policy provides guidance about establishing the professional medical practices while using the telemedicine technologies. Thank you for joining us today, and we look forward to working with you.